Hello, and thank you for joining us today for one of 3 podcasts about home dialysis. Today, our special guest is Monica Jemison, who is going to share her thoughts on home dialysis as a treatment option from the patient's perspective. My name is Kim Buettner, and I'm the Associate Director of Patient and Family Engagement with the End Stage Renal Disease National Coordinating Center. We partner with patients, caregivers, healthcare providers, and the Centers for Medicare and Medicaid Services, also known as CMS, to create resources to help kidney patients improve their quality of life. Healthy kidneys clean your blood by filtering out excess minerals and waste products and help balance your body's fluid levels. They also produce hormones that keep bones strong and create red blood cells. When kidneys fail, harmful waste and excess fluid build up in the body. This can have an impact on almost all other systems of the body. There are several treatment choices available when someone's kidneys don't work well enough to maintain health, and a few of those choices include receiving treatment at home. Home treatment options include home hemodialysis and peritoneal dialysis, also referred to as PD. Our guest today, Monica Jemison, chose to receive dialysis at home with PD before receiving a kidney transplant. Usually PD is done for several hours a day with the help of a machine. This treatment does not use needles, but instead relies on a thin, flexible tube placed in the belly. It uses the blood vessels in the lining of the belly, called the peritoneum, to filter the blood. Diagnosed with ESRD in 2011, she started PD in 2015 and continued this treatment for 2 years until receiving a transplant in 2017. She joins us to discuss her decision to choose PD and the impact it had on her life. Welcome, Monica. May I address you as Monica?
Yes, please.
Great. Thank you very much, Monica, for joining us today. How did you first hear about home dialysis, and when did you first think home dialysis would be an option for you?
Well, I was in the hospital sick and not knowing why, and that's where I first met my nephrologist. And after, she got me stable, we met in her office. And during that meeting, she talked to me about what kidney disease is and why I have it and what the future looks like. And then she scheduled me for a few more appointments over the next 3 months. And so after that, I went and met with her nurses who were there in the office. So I would have my appointment with her, and she would check my lab. And then after that, I would sit with the nurse, and the nurse would talk to me about all of the different modality options.
What was the most useful information in helping you decide?
Well, the most useful, honestly, was talking with my doctor. The second most would be, of course, those training sessions with the nurse. They showed me plenty of videos, gave me notebooks to take home and read, and all these different resources that I could look at. So when I came back to the next appointment, I was able to ask all the questions that I needed to. But the number one thing that helped me decide was when I asked my doctor, what would she do if she were in my position? And, of course, she didn't want to tell me what to do, so she kind of danced around it a little bit. But eventually she said, if I were doing dialysis, if I had to do dialysis, I would choose PD. And that let me know that it was a safe option because my doctor would do it if she were me.
Why did you choose to receive dialysis at home?
At the time, both of my younger children were in elementary school. My son is autistic, and my daughter is in Girl Scouts, and I was the troop leader. My oldest son had just had a new baby, and so I was a new grandmother. So my family was really important in making that decision. We were also a one-car family, and it was just more convenient for my husband not to have to worry about taking me to and from around his job and everything. So it was a lot less stressful. And, of course, we live in Illinois, so weather was a big thing that we needed to consider, too.
Describe the discussions you had with your children when you explained to them that you would be doing dialysis at home.
When my husband and I decided that we would be doing dialysis at home, one of the things that we learned from the nurse is how to talk to kids. And so we decided that we would use the fish tank analogy, which, fish use a filter to filter out all the old food and waste and things like that. So we use that to describe how the kidneys work. And so because my kidneys weren't working very well, we needed to do it at home at night while I sleep so that my body could keep swimming like a good fish, And so they really understood that a lot. And so they were really willing to help out, as much as they could. And of course, I gave them little things that they can do to help out. And they were very willing and welcoming, and it didn't bother them at all.
What led you to choose peritoneal dialysis instead of home hemodialysis?
Well, the biggest difference between the two, of course, is when you're using a fistula versus a catheter. And for me to do it at home, I wanted to be able to do it by myself, because, again, we have a busy family, and if, my husband wasn't home or my older son wasn't home, I wanted to be able to do it myself without having to put too much of a burden on everyone else. So that was the number one thing. And I know that there are times when you can do hemo by yourself, but I really wanted to be able to take care of myself in case of an emergency. So once we decided to go through the training to look at both of them to see which one, my husband said, this would probably be better because we would not be dealing, with my actual blood. And for him, that was a big concern.
Describe the discussion you had with your husband about the possibility of treating at home.
Well, the great thing about him is that he came to every single one of my appointments with me. So, on our way home from the appointment, we would talk in the car about what we had just learned that day. And so because we learned about it together, we came up with questions together. Once we realized, okay, this is definitely going to be a real thing that's going to be happening, we looked at every single absolute possibility. And, we looked at the logistics of it, where we would keep the equipment, would the cycler fit in our bedroom, or if we were doing hemo, would we be able to do that in a comfortable location in our home? How would it affect the kids? And like I talked about before, emergency situations, if there's a power outage, what would we do then? So we really talked a lot about, from the very minute to the biggest overall picture, how would this affect our family? And so we went through the whole thing together and we made the decision together.
What were your concerns before you started, and how did you get past them?
My first thought is never of my feelings. My first thought is always logistics first. And so I was mostly concerned about, how would this work? I knew that choosing PD was a safe choice. After talking with my doctor and my nurse, I was not concerned about that part at all, because I knew that I was in good hands and I had a good safety net around me. So if it wasn't working out right, or if I did do something wrong, I knew that they were there to take care of me. So my biggest concern was my ability to do it. I felt a lot better once I went through the training. I think it was 3 or 4 weeks long. And every day my husband and I went and sat with another nurse and learned how to do it. My biggest concern was, can I do it and how can I do it? And so once, I started doing it, each day I felt more and more confident. And so over time, I just felt better about it. So it wasn't anything specific that I was concerned about. It was just, getting into a good routine, how to make that routine work for our family.
What concerns, if any, did your husband have about you receiving dialysis at home?
Again, he was a lot like me, where we felt confident in the actual modality. His concerns were more about how can he make it easier for me? So his participation in it would be to make sure that I had all of the tools that I needed daily to put it all together for me so that when it was time for me to set up, I would not have to worry about, running all over the house looking in boxes and things like that. Because he went through the training with me, of course, we both took notes. And so one of the notes that I didn't realize that he was thinking about was how to make it more convenient for me. So another one of the things is that he decided to do was to make sure that he made a sign for me to put outside of my door when I was setting up so that the kids wouldn't come and bother me. Or he would make sure that, if it starts beeping while I'm asleep, that, it's not something that's, a problem, that, to see if I need to be waking up or anything like that. Because I am not a sound sleeper at all. So I usually wake up anyway, but just in case I didn't, he wanted to make sure that he understood what all of the functions meant and all the alarms and things like that. So that's the notes that he was taking while we were going through training. And of course, I'm thinking of how to do it. He's thinking of what can I do to make this better.
What recommendations would you make to someone who is thinking about a home dialysis treatment?
Research. If you don't get very much information from your doctor, of course, ask for it. If you have access to the dialysis nurse before you start, talk to the dialysis nurse, get as much information from them as you can. I would also suggest that you talk to other patients. Ask your doctor or your nurse if there are any other patients willing to talk to you about what they're doing. Another wonderful idea that really, really helped me a lot was to go on Facebook and find a group who are doing TD or doing home hemo and figure out, okay, what are they struggling with? Is that something that I should worry about? Because when I did that, I got a lot of extra questions that I wanted to have answered. So being in that group really helped me to learn about some of the other pitfalls that might come my way so I can talk to my doctor about it, see what we can do to circumvent that so it doesn't happen. So talking to other people, getting online, even looking on YouTube. A lot of people post videos of themselves setting themselves up and things like that. That was very helpful for me too, to see someone doing it that was not staged, provided by, say, your dialysis clinic or what have you, but someone who is literally really doing that, on their own in their life, and that's what they do. Because it's a lot easier when you see someone whose life is truly affected by this than, say, an actor in a video. Not to say that those are not real, but, firsthand experience is always the best experience. But my number one piece of advice is to talk to your team, not just your nephrologist, not just your nurse. Talk to your primary physician. Talk to your surgeon that's going to put the either the fistula or the catheter in. Talk to every single physician that sees you, every nurse that sees you. Talk to them about what you're deciding to do. Talk to them about what your options are. See if they have any advice. Sometimes they won't. Sometimes they will have no clue what you're talking about. But it puts the thought into their mind so that when they see you again, they can do a little research themselves so that when they see you, they can say, so how is that going? How can I help you with that? So that is the number one thing that I would suggest. Talk to your entire team. Make sure they're on board.
Monica, it has been a pleasure to speak with you today. We are grateful for your time and dedication to improving the quality and experience of care for all those touched by ESRD. Thank you. We thank you for listening to this podcast. To listen to the rest of our podcast series on home dialysis or for additional information on home dialysis options, visit the End Stage Renal Disease National Coordinating Center website at www.esrdncc.org or talk to your healthcare provider.